I am going to do the demonstration of medication administration. My patient name is George McDonald and my time of medication is 18 hours. I am reading the scenario. I am entering into the patient's room. I am checking the safety and providing privacy by dragging the curtain, performing hand hygiene. Step 1, 2, 3, 4, 5, 6, 7. Hi George, are you alright? Yes. So my name is Jean. I am one of the registered nurses working in this medical assessment unit. So are you alright now? Okay. So I am here to do your 18-hour medication administration. Is that alright if I proceed? Alright, thank you. So before proceeding further, could you please tell me your full name and date of birth, please? So my name is George McDonald and date of birth is 1st January 1937. So I can see your wristband. So I can see your hospital number in that. It is 00655432. I'm happy with that. So George, could you tell me, do you have any allergies? Yes, I am allergic to penicillin and latex. Oh, I am so sorry about that. I can see your red band on your hand. All right, it says penicillin and latex. So could you tell me what happened when you had exposure with the latex before? So I had rashes at that time. All right, thank you for that. So when you had penicillin, what happened? It was anaphylaxis reaction. Oh, yeah. I'm so sorry about that. Anyway, I will make sure you won't get any kind of this or exposure during the hospitalization. Okay. So, before proceeding further, I would like to know something about your details. Is that okay? So, do you have any swallowing difficulties or nausea, vomiting, something like that? No, I don't have any. Alright, thank you for that. So, I am going to take your medications and I will be back. Is that okay? Do you have any pain, by the way? Yes, I have pain in my legs. Alright, oh, I will make consideration. Okay, anyway, I will check the medication. If there are any analgesic there, I will definitely give it to you. Alright, thank you. So, this is your call bell. And if you need me, please press the buzzer. I'll be back with the medications. Thank you. 1, 2, 3, 4, 5, 6, 7. Examiner, is the tray cleaned within 24 hours with soap and water? Yes. So I can see the tray and a glass of water and the pots for the medication and the medication cupboard. So I am going to match the medications with my mark chart of the patient. So patient name is George McDonald, surname is McDonald and forename is George. Date of birth is 1st January 1937. Hospital number is 00655432. I have already checked it with that with the patient and I am happy to proceed. Ward medical assessment unit, date of admission today, height 1.58 meter, weight 45 kilogram, and the consult name is BK. Time of admission 10 o'clock. And the name of the prescriber is given and plate number and signature, everything present. So I'm going to write my name and the person of administering medication. An initial, signature, and base, medical assessment unit. And I can see the allergies, penicillin, latex, and effects of penicillin, it was anaphylaxis, and for latex, it was rashes. In the next page, I can see all the details are matching with my patient's clinical report, and I can see the codes, and I can see once only medications, IV paracetamol for pain. It was given at 12 o'clock. It is not my due. And the next page, I can see all the details which is matching with my patient. I can see the prescribed oxygen. Unfortunately, it is not my due. The next page, I can see all the details which is matching with my patient. And I can see antimicrobials. Drug name is clarithromycin. Date today, start date today, finish date within 6 days. Dose 500 milligram, frequency BD route per oral, duration 7 days, time 18 hours, and prescriber signature and blip number present. And prescription is legible, valid, and clear. I am happy to proceed. This is my due. I am going to put a dot in the 18 hours. I am going to take medication from the medication cupboard. I open the medication cupboard. I can see the clarithromycin medication. I can see the batch number. It is 00254, and expiry date is 2024-11, and the dose is 500 milligram. So the tablets in it is 250 milligram. So I am going to take 2 tablets. I am going to put in a pot. In a pot. I am keeping the medication in the tray. And next page, I can see drug name is digoxin, and dates today, start date today, finish date within 5 days, dose is 125 microgram, frequency OD, route per oral, duration within 7 days, time 18 hours. I am going to put a dot in it. Examiner, could you please tell me the heart rate of the patient? Okay, so it is within normal range, and I am happy to proceed. So I am going to take digoxin. I can see the batch number of the digoxin medication SB00267, and the expiry date of the medication is November 2024. So it is 125 microgram. So the medication is 25 microgram per tablet. So I am going to take 5 tablets. In another pot, naming the medication in the tray. The next medication is Nemantin. Date today, start date today, finish date within 7 days, dose 5 milligram, frequency OD, route per oral, duration 7 days, prescriber signature, bleed number, everything present, and prescription is valid, legible and clear, and I am going to put a dot in it. This is my due. I can see the medication name, batch number, and the expiry date is 11/2024. I am going to take 1 tablet because it is 5 milligram. And I am putting the tablet in the pot. And I am keeping the pot of the tablet near to the medication bottle. And next medication is donazepam, and dates today, dose 10 milligram, frequency OD, route per oral, duration 7 days, start date today, and finish date 7 days, prescription legible, valid and clear. It is not my due. Next one is drug paracetamol. Dates today, dose 1000 milligram, frequency 46 hourly, start date today, finish date 7 days, route per oral, duration 7 days, and prescriber signature and blip number present. Prescription is legible, valid and clear. As per patient have the pain, I am going to take the medication. So I am going to write the time of the medication because it is aspirin medication, and I am going to put a dot in it. Then I am taking the paracetamol medication. And I am putting it in the pot, another pot. I can see the paracetamol medication, the name of the medication, and the batch number and expiry date. Batch number is SB00267, and the expiry date is 11/2024, and I am taking 2 tablets because it is 500 milligram, and I am pouring it in the pot, and I am keeping this medication bottle near to the pot. I can see the next page, the medication all the details are matching with my patient, and it is about infusion. It is not my due. I am performing hand hygiene. 1, 2, 3, 4, 5, 6, 7. I am going to the patient side. Hi George, are you alright? Yeah, I am back with the medications. So before proceeding further, could you please tell me your full name and date of birth, please? So it is George McDonald. My date of birth is 1st January 1937, and I can see the ID band. Your hospital number is 6600065432. So yeah, could you tell me, do you have any allergies? Yes, I have allergic to penicillin and latex. So could you please tell me what happened when you have the exposure with the latex and penicillin before? So for penicillin, I had anaphylaxis reaction. For latex, it was rashes. Alright, thank you for that. Everything is matching with my record. Alright, so I can see the red band as well. Alright, thank you. So I have 4 medications for you. So I am going to tell you about some side effects and why you are having this medication. So first of all, first medication is clarithromycin. That is an antibiotic medication, and it has some side effects like diarrhea and nausea and fatigue, something like that. So actually, doctor prescribed this medication for you for the chest infections. Are you alright for that? Alright, thank you. So the second one is digoxin. That is for your heart problems. So that will maintain your heart in the proper condition. Is that okay? Alright, thank you. So next one is namantine. I'm going to check BNF with the namantine. It is namantine for symptoms like dementia and Alzheimer's disease. So it has some side effects like you know, balance impairment, constipation, dizziness, drowsiness, etc. Are you okay for that? Alright, thank you. So next one is paracetamol. This is for your pain. Are you alright if I am giving paracetamol? So they have some you know, some side effects for paracetamol, some difficulties in the gastric related to your abdomen. There may be some side effects like that. Are you okay if I am giving the medication for you for the pain? Alright. So are you going to take all the medication together? Or together? Alright. So I'm putting all the medications in one pot. So here is your water. So examiner, can I assume that patient had the medications? Alright, thank you. Are you comfortable now? Alright, thank you. So I am going to replace all the medications in the medication cupboard. And this I am going to clean the medication, tray for the next use. And I have replaced all the medications. And I am going to put my sign and date in all the required area. So clarithromycin, my name, initial and date. Digoxin, memantine, paracetamol, So, George, are you okay? Yeah. Alright. So I am going to write omitted doses date today. I don't have any omitted doses. Alright. So I am happy to leave. So if you need me, here is the call bell. So I'm going to wash my hand. Alright, I am happy to leave.